Hi, I'm Greg Dell, and I'm here with attorney Stephen Jessup. And today we want to discuss back disorders and how they affect long-term disability insurance claims. So, Steve, right off the start, I want to discuss about why is it that people who have disabling back pain kind of, in my opinion, receive some of the most scrutiny in their long-term disability claims.
Well, I honestly think it comes down to the real fact that pain, one experience it is subjective in nature. It's based on what's being reported. It can be verified through objective evidence, such as MRIs, X-rays, CT scans, whatever the case may be. But the actual expression of that pain is always going to be subjective to the person. So the insurance companies always are trying to make that argument that even if you do have objective findings, they don't believe that those findings are severe enough to verify or support the level of pain someone's reporting. So anytime there's left up to some form of interpretation, the insurance companies tend to review those claims rather harsh.
Okay, so you talked about subjective and then there's objective, but for people who aren't in this every day like we are, what's the subjective nature of a claim that the long-term disability carrier would be referring to?
That I'm in too much pain to be able to work, that I can't lift, I can't move around the way I need to do the job. I'm not able to sit the entire time. I have to lay down. So it's the subjective complaints that a person would present to a doctor, and doctors ask, what hurts? How are you feeling? What can and can't you do? Those are a lot of times the subjective components of a pain condition, related to the back.
Okay, there's no instrument to measure pain.
Correct.
I mean, there's no medical tool, there's no test that measures pain. Obviously, if someone has a fracture in their spine, something super obvious, then yes, you could say, yeah, that's something that would reasonably result in pain. But let's shift to the objective evidence, which we know is usually found on X-ray, MRI, or CT scan. And that's where you get into, okay, here's your diagnosis. You have radiculopathy, you have a herniated disc, you have osteophytes, you have degenerative disc disease, all of those things. And usually they say if you're over 40 years old, you're going to have an MRI of your back and it's going to show degenerative disc disease. And that's where we always hear them say, well, look, diagnosis doesn't equal disability. So what do we do about that as disability attorneys when we're presented with, hey, I have an MRI and I'm in pain, but the disability carrier still doesn't believe me?
Well, I think the biggest thing is always drawing that nexus between the physical condition you have, the diagnosis you have, and what you're experiencing from that, and the demands of your occupation. That's where it gets, somewhat complicated. Obviously, if you have multiple herniations in your back, and you have a physical job, it's a pretty clear-cut case. But where the insurance companies really come in, and since a lot of jobs nowadays are in the sedentary or light-duty capacity, they'll argue that, oh, we understand you have these problems, but we don't see how it prevents you from doing your sedentary job, being able to sit, lift up to 10 pounds, things along those lines. So it's really trying to establish how those diagnosis and the restrictions that the doctors are stating, and the rollover into how it's preventing you from doing those occupational duties. That's really where the work comes in.
Okay, so here's the real thing where we're able to assist claimants, and I think it all comes down to basically how the doctors are documenting the complaints of the claimant. Mm-hmm. And more often than not, we see that it's just not documented properly. And as a result of that, the insurance company basically tramples the doctor's opinion and is able to grant a denial. So I think it's very strategic how we educate the claimant and also work with the doctor to make sure that the documentation is exactly what we know from our experience that the disability insurance company is looking for. Let's be honest, the disability insurance claims examiners are, some of them have college degrees. They're clearly not medical doctors. They're usually not nurses or anything like that. They just don't have big medical backgrounds. So they have limited training in what to look for. And they often just send it out to a nurse or a doctor to review the file. So as a claimant, you really have to be aware of what your doctor is documenting and how you document it. The other thing is if we're talking about someone with back disorders, and the biggest challenge is sedentary type jobs, like you said, which is the majority of jobs, is using things such as a functional capacity exam or daily journals of pain or daily journals of your activities of what you're doing, trying to explain to a claims examiner that this isn't about, me just walking, doing my errands, taking my kids to school, going shopping, getting the mail, walking the dog, whatever it is. This is about being in the office for a minimum of 8 hours a day and being able to function while I have this stabbing pain in my back, while I have numbness going down my leg, while I can't sit anymore, so I got to stand up every 20 minutes, while I got to lay down, whatever it may be. Everybody's symptoms are different with the back, but the disability carriers don't look at that. And they really, if they don't see the documentation, they're not there. So the next thing is, besides the medical records, is how we work with a doctor to get the attending physician statement for back disorders completed. How important is that? And also about the specialty forms that we do versus the 1 or 2 lines that the doctors ask for in the standard insurance company form.
Yeah, well, what it comes down to in your standard form as well, more often than not, they don't even give the doctors the ability in their standardized forms to be able to indicate anything lower than sedentary ability. So a lot of times doctors will fill it out and they'll check the lowest one thinking that's what needs to be done. And that becomes a trap, if you will. So, in specialized ones, it's going to take what's in the records, what those restrictions and limitations are, how long can they sit for, how long can they stand for, what they can lift, positional type things, and kind of going in those forms to send out to the doctor, almost in a step-by-step way with respect to what someone's material duties are of their occupation. And another interesting thing what the insurance companies will often neglect when they are looking at the vocational side and this idea of a sedentary job, most sedentary jobs are the type of job that's going to require some type of cognitive ability. It's another thing you also want to have in the records is this idea that if you're in pain or even the side effects of your medication are affecting your ability to concentrate, to think, and especially if you're in an occupation where that's really what your duties are. You're not getting paid because you can sit, you're getting paid so you can think, making sure all of those things are addressed. So really working with the doctor to paint this very detailed picture of what the problems are and how those problems are going to adversely impact the ability to do one's actual job.
You brought up another point there, which is huge, is, yeah, I'm in pain, I take the medications, it alleviates my pain, but now I'm in this fog, I'm not supposed to drive, and I can't focus at work. So, okay, the pain's reduced, but I'm on these painkillers, and then we know there's this whole horrible issue with addiction to the painkillers, and then, so it's like this double-edged sword. I get rid of the pain, but then I can't focus at work. And then what happens is the insurance company says, well, you didn't say anything to the doctor about the side effects of your medication, so we assumed you were fine, which is obviously a huge problem with the pain meds. And then the other thing is, claimants, well, the doctor suggested surgery. Is the insurance company going to make me have surgery? And do you have to undergo back surgery in order to prove that you're disabled? Or if you don't have back surgery, are you going to lose your benefits?
Well, you don't have to undergo a surgery to establish benefits. Kind of along that same line, what you're saying with medication, if you decide because of the side effects of the medication, especially issues with addiction, that you don't want to take the medicine, or you take higher doses of non-narcotics or over-the-counter medication, just try to deal with it, the insurance company will use that against you by saying, well, your pain must not be that severe if you're not even taking medication. So they won't force you into having a surgery, but they can be real creative in the ways that they make arguments that, well, if you were in so much pain, you'd be taking medicine for it, as opposed to just taking it at the face value. So that is a huge double-edged sword.
Right, so clearly you don't have to have back surgery. You don't have to undergo epidural or cortisone injections or anything like that in your back in order to maintain claims. You just have to do the appropriate treatment recommended by your doctor. And the important thing also is that you do regular treatment. It's not enough to just go to the doctor once and say, my back hurts, and then, not go again. And also, you can't tell your doctor that you can't do certain things, because you can be assured that the disability insurance company is going to try to get you on video or look in your social media profiles like Facebook or Instagram or whatever you may use and say, oh, we saw you on this trip, we saw you doing skiing, we saw you doing, playing basketball or running or whatever it was you were doing, and therefore we think you can work. So you have to be aware of those things also. And even though you might have had a good day and you went out for a 20-minute jog and then you laid in bed for the next 2 days, the disability carrier doesn't care about that. They only care about what they catch you doing. So it's another thing to be aware of. So Steve, this is a good little summary about the complexities of a back claim and how we can assist a claimant to put their claim in the best light possible. We always offer a free consultation. We can help you at any stage of your claim, whether you're applying, you're on claim and worried about an issue that could potentially get your benefits denied, or you've been denied. Call any of us at any time, and we look forward to the opportunity to speak with you.